Minister of Health Terrence Deyalsingh has confirmed that at least 3 university students have returned to Trinidad from Hong Kong over the past few weeks, which has recorded 15 cases of the novel coronavirus. The minister reassured, however, no cases of the coronavirus have been transmitted into Trinidad and Tobago, and he said the student who returned to Trinidad last Friday after travel restrictions were implemented is under a self-imposed quarantine.
Student, that Trinidad and Tobago national who came in on Friday is in self-isolation and has been since Friday. And that is the protocol being followed around the world. People who are low risk are put into self-isolation instead of institutional isolation.
The health minister was responding to a question from independent Senator Hazel Thompson-Ahi in the upper house on Wednesday. He further explained what is a self-imposed quarantine.
In this particular case, that student only lives with one person. And so the risk of transmission amongst many family members is close to zero. And self-isolation means they keep a distance from anybody else, normally 3 feet. And close contact means close contact for 15 minutes or more.
Meanwhile, the Embassy of China in Port of Spain, in a media release, said it will continue to monitor the entry of Chinese nationals into Trinidad and Tobago. According to the Chinese embassy, as of the 4th of February, there has been 20,438 cases of the coronavirus, with 425 confirmed deaths. The embassy said the coronavirus has now been confirmed in 25 countries since the first case was reported last December in Wuhan. The Chief Medical Officer confirms the female passenger who was refused entry to this country on Monday at the Piarco International Airport was turned back because she was traveling within the 14-day incubation period. In light of the incident, Chief Immigration Officer Charmaine Gandhi Andrews was questioned at a sitting of the Public Administration and Appropriations Committee today, Wednesday, on whether the immigration officers who dealt with the woman would be monitored for symptoms of the coronavirus.
Have direct contact with the individual. Of course, they were utilizing their gloves and whatnot to examine the passports, etc. The passenger was put into isolation at Port Health and dealt with accordingly. But certainly any officer, not just an officer, any person who might have come into contact, and I'm speaking about airline agents, etc., should monitor themselves to see if they are coming down with any fever, and if they are, then they take the necessary precautions.
Even though the passenger arrived from Guyana, her journey had originated from Hong Kong. The PAAC members wanted to know the status of the passengers on the plane. Chief Medical Officer Dr. Roshan Parasram explained that the woman was a low-risk case.
On that flight are also considered low risk. Okay, so that passengers on that flight, other than going through the normal screening, would not have been alerted.
Because of her personally low risk upon history, and Dr. Fraser wouldn't have indicated that she would have gone from, I believe, Hong Kong to New York, from New York to Guyana, then to Trinidad after spending some time in Guyana. And U.S. has stringent measures in place in terms of history as well before they actually allow you in.